Addison's disease by Jenna and Sean. Addison's disease occurs when the adrenal glands do not work correctly due to damage. This damage can occur for many different reasons that will be discussed later, but it results in the lack of production of the hormones cortisol and sometimes aldosterone. There's no treatment for Addison's, there's only hormone replacement therapy, which is often very effective. However, if it's left untreated, it can cause death.
So the adrenal cortex consists of 3 layers. The most outer superficial layer is the zona glomerulosa. This is the site of aldosterone production. The layer beneath that would be the zona fasciculata. This is where cortisol is produced. And beneath that would be the zona reticularis, the final layer, which is the site of androgen production, which is sex hormones. This would be the main site of testosterone production in females. So on the left here, we got a fully intact adrenal gland. All the layers are intact. On the right, we have a severely damaged adrenal gland, likely to autoimmune attack. And you can see that the only remaining layer of this cross-section would be the zona reticularis, so they'd still have some androgen production there. The rest would be severely limited. Okay, now on to the effects Addison's disease have on hormones in your body. So the diagrams on the left is cortisol. So when you get a stress, this triggers the hypothalamus to release CRH, which would in turn trigger the pituitary to release POMC and ACTH hormones. ACTH is used to cause the adrenal glands to release cortisol, and cortisol, when released in the blood, will increase the blood glucose. And when blood glucose levels are elevated, this causes negative feedback to shut off the pituitary gland. Now on the right, you can see due to the damaged adrenal gland, there is no cortisol release to raise blood glucose, so there's no negative feedback, so the pituitary gland becomes hyperactive. And on the right, we have aldosterone, and baroreceptors would detect low blood pressure due to low blood volume, and this would cause the kidneys to release renin to activate angiotensin II, and angiotensin II would activate the adrenal glands to release aldosterone, and aldosterone would increase sodium reabsorption, and that would in turn increase water reabsorption, raising blood volume. Since the adrenal glands cannot produce aldosterone, blood volume would remain low, and there'd be a homeostatic imbalance due to low blood pressure.
The main cause of Addison's disease is often due to an autoimmune response. It's a complicated process, but an autoimmune response is generated, and the personal antibodies begin attacking the adrenal glands and wearing them away, causing that damage. This affects many systems as a result of the decrease in those crucial hormones. So you're mainly at risk if you already possess an autoimmune disorder or disease, or have cancer. If you possess an infection such as tuberculosis, this used to be the most common cause of Addison's disease. You have bleeding into the adrenal glands, or you have AIDS. Age is typically not considered a risk factor because it has been seen to occur at any age.
Now on to symptoms. So weakness and fatigue would be attributed to having that low blood volume and thus low blood pressure. And during times of stress, the lack of cortisol would mean your blood glucose levels are low, so you'd feel weak in those situations and tired. The weight loss is usually due to having anorexia or vomiting. The Addison's patients sometimes have. The hyperpigmentation is from an overactive pituitary gland, which had no negative feedback from cortisol production would cause the pituitary gland to release high levels of POMC hormone, and POMC would trigger a melanocyte formation, which would make your pigment darker. Nausea and vomiting is usually from Addisonian crisis, and those are triggered usually by like trauma or shock to the body. And the salt craving, well, you're not producing aldosterone, so you're urinating a lot of the sodium, and your body needs sodium for blood volume and many cell membrane functions like action potentials.
Addison's is considered to be a rare disease that only affects 1 to 2 per 100,000 people in Canada. It can affect people of any age or sex, although it's more prevalent in women and in those aged 30 to 50. A summary. So the usual cause of Addison's disease is an autoimmune response from the body. The symptoms can vary depending on the damage to the adrenal glands and just how deficient the hormones are. It's usually things such as fatigue, weakness, and hyperpigmentation of the skin, although because these are very typical symptoms of other diseases, it's very commonly written off as other diseases, and it's not diagnosed until a major crisis or injury happens where the hormones are immediately needed. Again, the range of severity is quite large depending on how much is damaged, and the risk factors include things such as already having an autoimmune disorder, having AIDS, having cancer, or having a disease such as tuberculosis.
Okay, question time. Question 1. What is a consequence of the disruption of the cortisol feedback loop? Okay, answer would be an overactive pituitary gland due to the lack of negative feedback from the elevated blood glucose from the cortisol, and this can elevate the POMC hormone in the blood and cause hyperpigmentation. Okay. Question 2. Define primary adrenal insufficiency, which is Addison's. Answer. When damage occurs to the adrenal gland and adrenal hormone production is severely limited. Okay, question 3. True or false? The current most common cause of Addison's disease is tuberculosis. Answer. False. It is believed that autoimmune reaction is the most common cause. Question 4. Fill in the blanks. The protein blank attack the adrenal glands to cause a disruption in the hormones blank and blank. Answer. Protein antibodies, and then the hormones cortisol and aldosterone. Thank you.